morning or a good afternoon, depending on which side of the country you are on today. Thank you for joining us for another entry in the Optimum Healthcare IT webinar series. My name is Larry Kaiser. I'm the Vice President of Marketing here at Optimum. So again, thank you for joining us. Today's topic focuses on the planning, the implementation, and the management of a Community Connect program. Our presenter today is Jeff Blanding, who is Optimum's Vice President of EHR Implementation, Managed Services, and Community Connect. Jeff is an experienced strategy operations expert with strategic engagements including interim CIO, pre-acquisition IT due diligence and planning, and development and leadership of an academic health system's $85 million capital budget. Additionally, Jeff spent 6 years leading implementations and product at Epic. Throughout the webinar today, there is an opportunity for you to use the questions panel on the GoToWebinar interface to put any questions you may have in there. We have left time at the end to go through all of the questions and be happy to work with Jeff to give you answers for those questions. Thank you again for joining us. Jeff, the call is yours. Please take it away.
Thanks, Larry. Can you hear me okay?
Yes, I can hear you fine.
Perfect. So hi, everyone. This is Jeff Blanding. I head up our implementation and managed services team here at Optimum. And as Larry mentioned, prior to Optimum, my background included several years in IT strategy and operations consulting, leading operations at a patient engagement startup, and then working in implementation at Epic in Wisconsin. So I've had a good amount of Community Connect experience. It does live within our implementation practice here, so I get to oversee any of our current Connect projects, whether that's new program formation, providing project team staffing, or optimization. And personally, I've gotten to work with, I think, about 10 or 11 different Connect clients, both for the hosts and for the recipients. So some of those are early planning as part of an initial Epic implementation that might have a Connect component to it. And then others were really on the recipient side with more mature programs and helping the recipients to navigate the different Connect decisions and the process there. So I've gotten a good firsthand view of kind of what works well and what some of the common challenges are. And today I'm going to take you through some of those key considerations for building and managing a Connect program from big picture strategic positioning through really the implementation and support process. And as Larry said, please do chat in any questions you have, and we'll be sure to address them either throughout or towards the end here. So I think most of you already know that Connect is a program that's going to allow Epic clients to share their Epic instance with non-owned, non-employed clinics and community hospitals. And I'll also note it's not, of course, unique to Epic, and oftentimes on new installs, the reason that we're talking about implementing an initial Connect site is because it's a replacement for a service they might already be providing via their legacy EHR. So today we will focus really on Epic considerations, but ultimately, most of the things we'll talk about are also going to apply to any other EHRs or other IT services that you might be providing to practices or to hospitals, smaller hospitals, larger clinics outside of your organization as well. There are a couple of different flavors of Connect, which are mostly driven by the recipient size. I think historically it's been about 200 beds, and I want to say about 200,000 visits for practices is where Epic kind of draws a line between small Connect versus big Connect. There are some differences between the two and how you interact with Epic and potentially what the approach to implementation looks like, but we'll take a pretty general approach. I'll call out a couple of differences here, but we're really trying to think more holistically about the program, so we won't get too into the weeds and the nitty-gritty of the large versus small projects. Now, I think one of the things I wanted to start with here is some of the pitfalls that we can see with Community Connect projects and some of the challenges that organizations run into when they're trying to implement a program and even when they're trying to support individual Community Connect clients. I think a lot of organizations get excited about Community Connect and all of the potential benefits, but I do want to point out that it's not all sunshine and roses. So the data you're seeing here is from a class report from earlier this year on Community Connect clients versus clients who buy direct from Epic. And you can see at the top, the blue data is the direct from Epic implementation and support and overall satisfaction. And then at the bottom, those orange bars are the instances that are through a Connect partner. And so I think that the key takeaway here is there's a pretty big disconnect in satisfaction. In general, your Community Connect clients are about 20% less satisfied with their implementation and with their overall instance and support model than the direct to Epic clients. So on the one hand, maybe that's not too surprising. You know, Epic's been doing this for 40 years. They are a fully dedicated software development, implementation, and service company. They don't have, you know, all the aspects of running a hospital and a health system that you have to deal with as well. But at the same time, it does certainly represent a missed opportunity for these Connect hosts, and I think demonstrates well some of the challenges that are associated with trying to build and manage a Connect program. So these are really the outcomes we want to help you avoid, and some of the things we'll try to focus on today of what to think about and plan for and position yourself so that you don't wind up in that situation where you have dissatisfied Connect recipients. Now, I think there are a few big reasons, kind of global reasons for that disconnect between the overall Epic satisfaction and then satisfaction with Connect hosted instances of Epic. And I think the most important thing to realize is that Connect is not just the same as rolling out to a new practice or a new acquisition for your internal practices or your internal hospitals that are fully owned. It may be a subtle difference, but I think that when your organization is a vendor to paying customers, it really changes the approach and it changes the recipients' expectations. Obviously, you know, it changes the fact that you need contracts, you need invoices, etc. But it also changes the role that your staff is in. They're now dealing with a paying customer, and that takes a different approach than dealing with your internal stakeholders. And I think that's true even if you have very mature internal SLAs and internal business relationship management methodologies and processes, things like that. I think there still is a fundamental difference there. Second, it really ramps up the importance of communication and of clearly defining your scope and your expectations, and it certainly makes stakeholder management a little bit more difficult. I think everyone on the phone who's an IT professional already knows that stakeholder management in an Epic implementation or an IT project in general is a challenge when it's an internal project. It's a challenge to identify the right stakeholders. It's a challenge to get them to come to meetings. It's a challenge to get through governance and to get decisions made. And that just becomes more challenging when you're now talking about external stakeholders where you can't necessarily pull in the CMO or the CFO or whoever the right escalation point is to push things through to the same extent that you could internally. Those are some of the external challenges. There are also challenges internally and some key things that you need to address as you're really running and defining your program. So first of all, you really need to clearly explain and position the value of Community Connect to your systems leadership team and to your internal stakeholders. And really being able to understand and explain how your Connect program fits into that overall strategy of your health system is going to be crucial to get internal buy-in, and then also to help justify the cost, both upfront and potentially years in the future, to make sure that you can justify that IT budget and really what the benefit of that IT budget that you might be devoting to a Community Connect program is. So today we'll really try to take you through a full kind of Connect life cycle. So really how to start with that early strategy development and positioning, how to then prepare for implementation. So with the staffing plan, your budget and cost models, figuring out what implementing it really looks like, and talking through long-term support as well. So I'll approach the topic really from the ground up, talking through if you were building it from scratch, what does it look like? But I think there is value here as well if you're already an active Connect site and have a pretty mature program. I think it's valuable to think about some of the pieces of the foundational work, whether you did them or not, and whether it might be worth revisiting some of those pieces to optimize your approach and make sure that both internally and externally you have the right approach, or if there's some areas where you could course correct. One final introductory thing to mention is I'm mostly going to be talking about a Connect program from the perspective of a hosting organization, so the Epic client who is essentially reselling their Epic instance. But I will also touch on some takeaways for those who might be a recipient. So the site that is buying Epic through the Connect provider. So there might be some good things to dig into and some considerations there as well if you either are already an active Connect recipient or are in a selection or contemplating whether you want to be one in the future. So I'm going to start with some high-level program goals and approach and how you start to define those in the Community Connect world. And one of the fundamental things to define early on, and frankly, I think one that frequently gets missed in early Connect planning, is clearly explaining the why behind your Connect program. I've seen multiple examples, and some of you probably have as well, where an IT executive or a CIO gets excited about Connect as an opportunity to become a profit center rather than a cost center. And I think that's understandable given the budget pressure that many of you are probably under. But I think ultimately that's usually not going to be a successful approach. In general, unless you get to a very large scale with your Connect program, it's unlikely to be profitable purely on the IT services and the IT revenue that you get out of it. And when you think about the price point that you need to hit to be attractive, especially to like a small independent practice, you're likely to be subsidizing your licensing and support costs. So there's not likely to be a break even purely on IT revenue there. So given that, one of the key foundational steps is to really understand what the non-revenue or non-IT revenue based benefits will be, and then to get agreement and alignment on that from your executive leadership and other stakeholders. Where possible, if you can tie those initiatives back to concrete financial results, that always will help. And it may be possible for some of these. So for example, if you see some tangible improvements to performance for value-based care contracts, that can be something that you can tie back to say, because we now have this increased information on this patient population where we're getting reimbursed based on outcomes, we're likely to see some improvement there. Other things like patient leakage, referrals are things that you can absolutely tie back to financial metrics as well. There's going to be some things that will also be somewhat less tangible, but in either case, really defining what those are and then how Connect will support those goals is really key to make sure that it does make sense for your organization and that everyone understands how it fits into the bigger picture. That's also going to allow you to set some high-level guiding principles, which will then help to set the direction of your program and ensure that you're pursuing partnerships that really are in support of those strategic goals. And just as importantly, that might mean not pursuing partnerships in the Connect world that don't support those goals. So potentially knowing how to say no and when to say no is a part of that as well. So again, obviously important if you're standing up a new program, but I think also worth considering if you already have a Connect program, could you succinctly kind of define the why behind it? And if not, it's worth revisiting and making sure that you're approaching it the right way. Now, once you understand what your health system's goals are, then you can really map back to how extending your Epic instance, your EHR instance, can support those goals and really build out the business case of why the Connect model is going to make sense for your organization. Once you have the business case built out, you also want to make sure that you have the right metrics, reports, and dashboards in place so that you can, once live, really tie back and make sure that you're hitting the metrics that you thought you would and that your Community Connect is bringing the benefits that you thought it would. And if not, allow you to adjust course and then measure, were you successful in adjusting course to get to those benefits. It's also important to mention, those metrics are also going to be important to justify that ongoing IT spend. So being able to say, yes, we had this large piece of our IT budget, or potentially even an increase in our IT budget, but we can tie that directly back to these other metrics that are important to the organization, and make sure that that's clearly communicated back as you get into budgeting season. Now, the important stakeholders to involve here, obviously, are going to be your senior IT management. Make sure they understand how you're setting up the program, what the ultimate goals are, and what that means for how you build and staff it from an IT perspective. You also want to involve your health system executive leadership to get that high level buy-in that, yes, this makes sense, and get the understanding of how it's supporting the overall organizational goals. Your business development team throughout the process is also key to involve. They're often the folks who are out visiting with those community physicians, those independent practices. They know kind of what they're interested in, and we'll also be able to drive that message about bringing them into the Community Connect fold. And then finally, your strategy team, whether you have a CSO or a vice president of strategy who can really help with the positioning against the broader backdrop of the organizational strategy. Of course, the internal piece is only one piece of your Community Connect positioning. You also need to understand what it looks like externally, and really what your external partners are looking for, and to make sure that there's ultimately a match between what you hope to achieve and what they hope to achieve. So some of the market questions that you want to ask and try to figure out the answers to, and again, I think your business development folks and your strategy folks will be key partners in this, in helping to understand the answers to some of these questions are really, who are your ideal Connect partners? So given some of the goals you talked about, if it's population health, ACO type goals, what does that mean in terms of the type of partner? What's your geographic area? What's your degree of patient overlap? What type of practices is it, et cetera, or hospitals for that matter? Understanding what your value proposition is in the marketplace, and ultimately what those practices or community hospitals would be looking for that would make you attractive to them. Is it, just getting a pretty fancy EHR at a lower price point that they might not be able to afford or might not be able to get otherwise? Is it a closer affiliation with your brand name? Is it ease of access into your diagnostic and OR facilities, things like that? Then also understanding, what is the competition? Right? That competition might be other Community Connect sites out there. It might be the Meditechs, Greenways of the world. It's not likely to be Epic. Is the good news for all of you is Epic tends to not go after the fairly small clinics, fairly small community hospitals, so it's likely not Epic. That's a note in your favor, but really understanding, what does that competition look like, and then what is your differentiator and your value proposition to that market. Now, the final step here, and kind of a deeper iteration of what we've been talking about with strategy, is really figuring out how all of those pieces come together and translate into what your Community Connect offering is. And I'll talk detailed scope shortly, but here I mean kind of bigger picture. So some organizations really have a pretty narrow scope, and it's essentially Epic and then the mandatory third-party applications that go along with Epic, and that's what their Connect offering is. It's kind of basic Epic, and that's what they need, what their market's looking for. Other organizations have fairly robust offerings where you might be talking about additional IT support services. You could be talking about desktop support, field services as a service to those non-owned practices. You could be talking about having a hardware purchasing program. There's some different pricing implications to these different pieces here that I'll talk about later as well. And then there's others that are even going beyond IT to do like outsourced billing management, for example. So ultimately, that decision is going to be driven by certainly your maturity and ability to support some of those advanced functions. This isn't something that every hospital is going to be able to or be interested in supporting, as well as how they tie back to your strategic goals and what the needs are in your target market and with your target clients. So we'll transition now from some of those maybe more abstract, high-level strategic decisions and approach questions to a little bit more of the nuts and bolts of how you start to define the details of your Community Connect program successfully. And we'll start with kind of IT team structure and how to think about adapting your existing IT team structure to a Connect model where you're now working with those external clients. So here's a pretty basic picture of how to start to think about your org structure. And I did try to keep it very simple because there are a lot of variations, and the full picture is going to vary pretty greatly based on your current structure, and then on the type, the scope, the size of your Connect program as well. But the piece I think is super important here is that account manager role that you see on the left-hand side. And you can call it a bunch of different things. It is called a lot of different things, but in general, it's often a new and different role than most of you have in your Epic team prior to a Community Connect program, and pretty important to manage your implementations and then ongoing support. So regardless of the size of your Connect partnerships, I think it is important to have that single point of contact for your Connect recipients, and really helps with dissatisfaction, maybe some of the issues we saw in that class report earlier. I think we've all probably seen some of the challenges with silos across Epic teams, across different application teams, with folks having sometimes narrowly defined lanes of functionality they know and workflows they know, end users they can support. And so really what we want to do here is ensure that we don't have those silos when you are talking with your Connect partners, that they have one point of contact they can go to for any question they might have, whether that's an Epic application, whether it's a third-party app, whether it's something with hardware. This person's really about managing that relationship, but also, just as importantly, keeping your team coordinated, avoiding those silos, and helping the team keep the holistic view across all of the workflows, all of the applications that Connect recipient might be using. Who that person is, it might vary a little bit. If your Connect program is new or on the smaller side, it might be just one role across all of your clients, and then also potentially be your overall Connect program lead, Connect director, who's defining strategy, leading implementations, etc. But as your team grows, or as your Connect client base grows, this may also separate into several folks. So you might have multiple account managers, relationship managers, whatever you want to call them, across multiple clients who are then reporting into your director or program manager of your Connect program. Early on, this is also a role that frequently gets wrapped into an existing application manager. It might fall under an ambulatory application manager, for example. I think that is a potential risk where it frequently isn't at the top of that person's list. They might be managing multiple internal rollouts and other initiatives as well. So it becomes one more thing on the list, and it's not the thing you want to get dropped, basically. So I think that's a risk, and it's something I'd encourage you to think about as a dedicated resource, where then your application managers obviously have oversight over the application pieces of it. Now, how your Epic team is organized in addition to that account manager type role is going to be pretty variable. In some organizations, you might have a separate Connect team, especially if you have a pretty robust Connect program that then has matrix reporting into the application teams. But I'd say just as commonly, you have analysts within one large Epic application team who are potentially matrixed into the Connect support, and maybe are dedicated, but have a variety of tasks across Connect and internal support work. And there are pros and cons to different structures. Really, I think the most important aspect is ensuring that whatever your structure, that your team knows the ins and outs of individual practice workflows, knows the right people, knows the right escalation paths at different client sites, and really having that dedicated point of contact is a good way to get that, because it means you have the person who can then help coordinate different analysts, kind of regardless of what their reporting structure or team structure is. Now, on the recipient side, the structure here is largely dependent on the partner size. So it comes back to that large Connect versus small Connect differentiation to some extent. So with a larger Connect program, like a community hospital, for example, you may well have some dedicated staff that have Epic training and or certifications. They might have admin capabilities within the Epic instance to a limited degree. And then they would be working directly with your application level staff. They would be kind of the go-between between the end users within that application subject matter area and your team as well. So one additional layer. With smaller practices, you probably won't have that. You'll probably just have that Epic lead, who likely is someone from operations, whether that's the front desk guru who knows everything about the practice, or one of the physician partners, whoever that winds up being, but would be much more high level at that point. Now, the next thing to talk about is diving into scope a little bit more. So earlier I talked about that high level scope in terms of what's really part of your offering. But really the next thing to think through is what are we offering them in terms of individual Epic modules, in terms of what we're actually building to them for them new versus standard. And obviously pushing your clients towards standardized workflows and then standard Epic build is going to really give you the most benefits with the most efficient level of support. So defining this up front is really important. You want to be able to go into a potential Connect implementation with a solid understanding of really what your Epic standard, quote unquote, is, and then what you're going to be able to customize for each individual client. So to that end, you really need to further refine the scope of your individual applications and your interfaces as well. Epic modules is generally pretty straightforward. Where there might be complexity is if you have potential clients who are using or would need Epic modules that you don't have already. So for example, you're talking to a vision clinic, but you don't use Epic Kaleidoscope. That's obviously a much more complex decision to whether to pursue and implementation as well. But generally, other than those cases, fairly straightforward, I would say. The third-party applications get a little bit more complicated. So some of them, like the Metaspans, the FDBs, the SNOMEDs, they're no-brainers because they're just building blocks of the broader Epic software package. But others are going to be more complicated to scope out and figure out, is this something that we should be offering? Is this something that there will be demand for? How would we then support this third-party application once we go to an external Connect site, et cetera? And then that also raises some questions around your integration. So even if you're not supporting and providing the third-party systems, where would you allow your Connect sites to plug in their own, and what are your standard interfaces that you'd expect to be setting up and supporting for those clients? This then ties into really the question of expected customization and what your standard services or standard build are. So some of this is going to be pretty cookie cutter, something like facility structure, for example. You need to collect the information, but you can define pretty easily. This is what we would expect to build out for new facility structure, and it's likely things that you have some familiarity with from internal rollouts. Then there's other areas, work queues, your go live critical report portfolio. It'll get a little more complex if you haven't already been through this exercise to really say, okay, what is our standard customizable group of work here? And it's build that you may need to customize, but you'll be doing so based on standard templates and standard defined scope. It's not something that you're starting from scratch and saying, hey, what do you need? Because that's where you'll get in trouble with all kinds of non-standard build that's then very difficult to support. Final thing to make sure that you can define, so that you can define for your recipient sites, is what do you expect from users in terms of their technical setup to ensure that they can access your Epic instance and that you can support them. So this might be things like, are there certain models of label printers that they would need to have? And very important to define, since there might be substantial cost implications here. So you want to define this up front. You don't want anyone to be surprised by this. Especially as this would be kind of on top of what you will be defining as their ongoing license and services costs through your Connect program. So that then brings us to a deeper discussion of budgeting. And I'm going to talk first about actual costs, and then on the next slide, we'll talk about translating that to pricing, since they're not exactly the same thing. Cost modeling is obviously a fairly sizable effort. It can take a little bit of time to get it right. Some of it's pretty straightforward. Your Epic, your third-party licenses, generally those will be fairly straightforward, and they'll be either based on your user, number of providers, number of beds, etc. You might have to get your vendors involved. You'll certainly have to get Epic involved early on, but fairly easy to get down to a formula that you can then use on an ongoing basis. Others will be less straightforward. So your support staff, for example, it may not be something you had to look at before to estimate, if we bring on an additional provider, if we bring on an additional set number of beds, what does that mean for support numbers for both an implementation and then ongoing for our different application teams. So you have to make some supportable assumptions along the way there, and do some diligence to really figure it out and start to get to something that seems like it makes sense. On the recipient side, you also need to understand what costs there are that are going to go beyond what the host is going to charge you for the implementation and then for ongoing support. So this is going to include staff to implement and support Epic. There might be staff that you have locally that you might need to employ on the IT team or otherwise, on top of what you'll be paying the host for. It may also include some of your subject matter backfill time. So if you're going to be taking physicians, nurses, et cetera, out of their duties to come into design meetings, eventually to come into training, then you need to think through, does that mean that we'll be hiring additional overtime to cover that? There's also the hardware pieces I just talked about. There might be a hardware uplift to get to what you need to have for the Connect install. So it might be end user devices, it could be e-cig pads, it could be making sure you have wireless coverage from a network and infrastructure standpoint, any of those aspects, so understanding those to really get to essentially a TCO. And then finally, your legacy decommissioning as well. If you're replacing a legacy system, there hopefully long-term will be savings there, but it usually costs you a little bit to get that archived as a one-time cost and potentially as an ongoing subscription-based cost for the archiving system as well. Now from cost, then we get to pricing, which is a little bit of a translation that you get to / have to do as the host of the Community Connect instance. So clearly we're starting with costs, all the different cost drivers that we just talked through, both from the short-term implementation costs of what it's going to cost to roll out the Epic instance for the new Community Connect client, and then also the ongoing operating costs of what are our annual license costs, our annual service staff costs, et cetera, that go into that. Then you also need to obviously layer in start compliance. So you can donate up to 85% of your EHR cost, but not 100%. And then there will also be separate rules around other pieces of this. So for example, you can't donate hardware. If you did want to implement some kind of a hardware purchasing program, they would have to pay 100% of the hardware costs. And once again, just because you can donate up to 85% of that for start compliance doesn't mean that you want to, but that's just one piece of it that you need to keep in mind. You also then need to focus on what is the market competition and ultimately layering those strategic goals of your organization. So you understand what's the price point that's competitive. So maybe you need to be competitive with the Community Connect provider across town. Maybe you need to be competitive with Meditech or Greenway or wherever. So what's the right price that maintains start compliance, but then also layering in the importance of your strategic goals. So what's the implied value of having those additional Epic practices on your Epic instance, and how does that impact what you would charge? And maybe that means you're closer to the as fully subsidized as you can be, or maybe it means you're less because the market price is higher, or you think there's less value to some of that the implied value of the strategic goals there. So it's more art than science, I would say. Obviously, the implementation, operating costs, all this stuff we talked about on the previous slide in terms of figuring out essentially a TCO for both you and for the recipient site. There's some good science there, but then when you start balancing in how important to the organization is this, how do we be competitive while staying compliant, that's where you get a little bit more of an art there. So finally, contracting and formal agreements, not likely something you have to deal with a ton internally. You may have some internal SLAs, but I'd say I see less of these than you might expect even internally. But in addition to the usual legal coverage, the indemnifications, the disclaimers, warranties, etc., the key here is really transparency on a lot of the items we've talked about. So things like application support, support services scope, the requirements from your recipient organization in terms of how will they need to participate in the implementation, what do you need from them from a tech infrastructure standpoint, outlining pricing, and then really starting to outline your implementation approach. So really for both host and recipient, the contract should eliminate any surprise about unexpected costs or scope and what is or is not customizable. It should also start to lay out the implementation approach. So based on host team capacity, what's the anticipated start date? Again, what customization is going to be provided as part of that? What is or isn't provided or expected from the recipient. So areas like conversions, training and go live support, you want to be very clear on what you're giving them and then what that recipient is expected to do. Are they expected to be formatting converted data in a certain way? Probably they're in charge of pulling it out of their system. So you just want to be very upfront on that so there's not confusion about who's responsible for what or what is or isn't included in the implementation and then in the support price tag. As I said, the SLA often neglected, and I think this again gets back to some of the issues we saw in the class data at the beginning around communication and around missed expectations. So the SLA should be very transparent about what support will look like. It's some of the basic stuff around what's our uptime, what's our, we have 24/7 support, and what does that look like? What's our escalation pathways? Those kinds of things. I think you also want to cover what is considered standard service or not. So what things are you going to build for them regardless, and then what is the process for that? If things are not in scope as kind of standard support, what is the process for those as well? So if a new order set, for example, is needed, is that a standard offering if we need to tweak one of those order sets? And if so, what do we do to get it done? If a new location, a new clinic opens up, what's the process to build that in Epic? And again, is that a standard service? Is there going to be some additional cost there, etc.? And I think the final thing to mention there is kind of the special project. So even for things that wouldn't necessarily be within your standard services scope, you want to have a good understanding of what could we do if we were willing to pay some extra money to get additional build, additional support, and then what's the process for requesting that, for getting it approved, for roughly what is our hourly cost or however you charge for those items as well. So moving on, I'm going to talk now the last 10 minutes or so here a little bit more tactically about managing implementations and then post-live support as well. And as we said, we'll have a few minutes left at the end for questions as well. So anytime here, you can be typing those in to Larry, and he'll be gathering those for us here. So once you have the groundwork that we've talked about so far completed, and you really have an understanding of what your offering is, how you're positioning in the market, understanding of how you'll be pricing it because you understand what your internal costs are, you're really ready to go out to your clients. Often I've seen you're already going to have a pretty good idea of who those initial sales prospects are. They might be a group, a clinic that you already have a very close relationship with. Maybe historically you've provided IT services to them through another legacy EHR or other systems. It might also be a group that's been asking you for this, so you know they're already pretty much on board. I think that's a great place to start because it means that you can start with that strategic direction. You can start with a well-defined scope, but really work closely with them to build out your implementation methodology and repeatable artifacts that you will continue to use for additional clients in the future as well. So the sales process really starts with a lot of what we've already talked about. So ensuring that your offering fits their needs, making sure they understand and that you're all agreed on the application scope, the services scope, the customization that you would be promising and them understanding what that is and verifying that that's a good fit for them, as well as costs and pricing. Then as you move into contracting, obviously there's all the things we just talked about in terms of the the legalese, the SLA terms, all those kinds of pieces. But also then you move into the meat of really discovery and figuring out, okay, for this client, what do we need to build for this client? Or really, what do we need to customize for this client? Because again, we're not starting from a baseline of 0 and designing from the ground up. We're starting within a framework of what we are willing to customize as part of our Community Connect program. But understanding how are we customizing those standard build items. And that's where that standard documentation is really helpful, so that you can have discovery questionnaires, you can have checklists that will collect the information that then you'll be able to really define the build, the customization that you need to do for them. You can also, obviously you'll want to have standard project plans. These things are going to be really helpful to you as the host to have a pretty rigorous methodology for how you approach it, but also for the recipients to be able to understand this is what the process looks like, this is what we need from you, these are some of our high-level milestones as we get through the project and get towards go live. Build and training, go live even really look pretty similar in my opinion to what you'd see with other new rollouts for your own practices. I think the main difference, if you want to call it that, is just the importance of continuing to pay attention to scope and some of the negotiations you might have with your clients around that. And I think that will tend to be more of an issue with your larger Connect clients, with hospitals especially, less so with smaller practices where they might not have super unique workflows or super robust needs. But making sure that you're managing that scope, watching out for scope creep, making sure that you're not deviating from your build standards, and along the way, just over communicating on everything to make sure a client understands where you are. Make sure that you're protecting the custom build to make sure that it really is going to be supportable in the long term. And then really as we get into post-live support, I'll talk about that in detail here. I think the over communication continues to be really important. Again, I'll tie it back to that class data that we saw, where I think a lot of it comes down to miscommunication. If you dive into some of the comments in that, a lot of it is dissatisfaction with changes happening in the environment that aren't clearly communicated, dissatisfaction with what's the status of enhancements, with break fix tickets, et cetera. I think probably the items we're familiar with internally, but then become more challenging even to manage externally. So when you're talking post-live support, immediately post-live, your first focus is, of course, on stabilization. But once those immediate issues die down and it's less about high priority break fix, it's important to spend some time with your clients on post-live visits, really understanding ongoing concerns or pain points, and then make those deep dive visits an ongoing annual, maybe semi-annual thing that you do with them to make sure that you're hearing some of the things that you might not hear or might not be able to see from break fix tickets and from enhancement requests. Another thing that's really good to do regularly is CSAT surveys. So you're getting, again, those kind of qualitative responses and understanding where are you off track in support with individual clients as well as across clients. It might be areas where you can course correct on individual Connect recipients, but also kind of across your program. Are there different tools you can put in place, different processes to make sure that you're hitting all the points you need to. Ongoing communication in terms of in-person or at least phone calls with your super users is important. Again, that might be department specific, it might be specialty specific. For smaller clinics, it could be basically your one super user who's your guru on Epic at that client, but will be able to really provide some color around what's going well, what are the challenges, and also give your team a chance to inform them about things that are upcoming. New release and enhancement communications are key as well. Hopefully you're doing that internally already, but expanding that to your external stakeholders here with Community Connect so that you're getting emails. You can use the Epic login screen. You might have other creative methods as well to make sure they know when things are changing. They can hear the outcome of various governance decisions on things that might be changing, as well as new releases. I'll hit it one more time. So I do think the communication is super important. So in terms of how you're managing that relationship, we talked about the irregular meetings, we talked about surveys, site visits. I think metrics is another key one here in terms of some of your Epic usage type metrics. Epic has a lot of really useful reports across physician pulse, across your decision support monitoring, click counting, all those kinds of things that you can use as really proactive measures to get a feel for how folks are doing and where they might be struggling or could have some opportunities to do better that maybe they're not asking you about, or maybe they don't know enough to raise as an issue. But being proactive there is important, and you've got the tools to do it within Epic. The upgrade and release management piece of that, again, the email updates is big, making sure that you get training materials updated as well, whether that's virtual trainings, whether that's on-site trainers who are embedded with the staff at your recipient sites, or that's your in-house as a host for Community Connect, whether that's your in-house training team. And really keeping an eye out for those optimization opportunities. That optimization could mean we're training providers on better ways to do things and the system doesn't necessarily change, or it could be moving buttons around, streamlining workflows as well, but keeping an eye out for those ongoing improvement opportunities so that you can continue to improve life for your Connect clients. Now, just to close us out here, it probably will not come as a surprise to any of you that Optimum offers a variety of Community Connect services, and we'd love to work with you on any of the areas we talked about or anything else Community Connect or Epic related, whether that's some of the early design type stuff in terms of defining your strategy, really building out a robust cost model, and then trying to figure out what the pricing model looks like for you. Whether that's working on rollouts, you already have a program, but you need some help staffing up from a leadership perspective, from an analyst perspective, from a technical perspective to roll out to new sites, new hospitals, etc. Supporting you through go live, whether that's with credentialed trainers or at the elbow support, or if you're a mature program, again, I think there's always value in looking at how things are going and trying to figure out, are there ways we could be doing it better? Are there better artifacts, documents, processes, et cetera, that we could be following? And finally, if you are not so much on the host side, but either a current recipient or a potential future recipient of a Connect instance, that's another area that we've got a lot of expertise and would be happy to sit down with you and try to think through, if there are areas that you could push for improvements in the way your program is being run today, or if you're trying to select between different potential offerings, what might be the key questions to ask, the key considerations there. So please don't hesitate to reach out to us on any of these areas, whether that's me or someone on our team. We'd be happy to sit down and talk through what your needs might be. And that brings us to the end of the presentation. So we do have a few more minutes here as planned. If anyone has questions, please chat them in, and I'll address anything that arises in the last few minutes here.
Great, Jeff, thanks very much. That was really informative. I appreciate the effort you put forth in that presentation. Hopefully our attendees found that information useful to them, whether they are a host or potentially receiving. So for the folks on the call, if you have a question, please feel free to drop it into the question area. In the meantime, Jeff, we have one question, and that's kind of around the data. Obviously, whether you're a host and you're reaching out to the community, or if you're a smaller organization and you're, getting absorbed into another one, there's a lot of data. Who owns that data? Is that part of the contracting process? So if you're a smaller physician practice and you're going to be, connecting with a larger organization, where does that data work? I mean, where's that PHI protected? Who owns it? Type of stuff.
Yeah, so who owns it is going to be the organization that generates it. So if you're a Connect recipient, even though your data might be in someone else's Epic system, that's your data. And so from a contract standpoint, that's something that, typically would be in there as your part of your termination clause to say, that the Connect host is obligated to provide you that data. And actually that goes with some of the recent regulations as well now, that we've got some legal support for that, as well as the contractual support that if you wanted to leave that arrangement and go to a different EMR, that the host would be obligated to provide an extract of that data for you to take with you. The other piece, from a privacy standpoint, you have a BAA as part of this, so that's another contractual piece there as well in terms of the breach protection and things like that.
Sounds good. Yeah, thank you for that answer. If anybody else has any questions, please feel free to drop them into the question box. We'll give that a minute or two in case anybody has a question. In the meantime, we will be posting this recording to the Optimum Healthcare IT YouTube page, and it will be on our website, and we will post to social media when this recording is available, in case you wish to listen and watch it again, or share it with one of your coworkers. So I'll just ask one last time, are there any additional questions? If not, we will end today's webinar, and thank you very much for everybody's attendance. Be on the lookout for our next installment of the Optimum Healthcare IT webinar series. We appreciate you attending, and we will see you soon. Thank you very much, and have a great day, everybody.